Today's episode is sponsored by Vitality Health RX Supplements. Whether you're an athlete, a busy professional, or just someone looking to prioritize health, Vitality Health RX has what you need. With premium ingredients and rigorous quality control, their supplements support your body's natural functions. Visit shopvrx.com and use code FEELGREAT15 for 15% off your first order. Thanks to Vitality Health RX for sponsoring this episode. Now let's dive in.
Hi, I am Dr. Andrea McSwain. Welcome to the Feel Better, Feel Great podcast. This is a series called Improve Organ Performance. Today we are having episode 121, Medicine for the Gut. First, as we dive into the podcast, I want to remind you that I am a medical professional, but the information shared here is for education purposes only. It is not a substitute for personalized medical advice. Please consult with your healthcare provider for guidance on your specific health needs. So here we go into improving organ performance. When we focus on the gut, I definitely want to stay very medical in terms of some topics or some diagnosis. Serving holistic medicine still means that I use diagnosis codes because I use it as a framework for how to provide a thorough treatment plan and also to take medical history, conventional medicine, standards of care, and then add holistic medicine to amplify the treatment plans and also gain results much faster. The medical conditions related to the gut that I will be discussing today and integrating throughout are irritable bowel syndrome, inflammatory bowel disease, which includes Crohn's and ulcerative colitis, the gastroesophageal reflux disease, or GERD, celiac disease, and peptic ulcers. So let's talk about conventional medicine's approach to gut health. When patients come in with digestive issues, they are often talking to their family care doctor or their primary. And when they do, the primary says, okay, well, let's get you to GI. Now, when you see a gastroenterologist, you are seeing an internal medicine doctor who has then specialized in the gastroenterology system. So gastroenterology means gastro, which is stomach, and entero, which means intestines. All right, so that's kind of what that GI, gastroenterologist stands for. Now, when you meet with a GI doc, they are also going to ask you about family history for cancer. They're going to ask you history on what your symptoms are. Generally, gut symptoms are abdominal pain or cramping, bloating, and then also stool regulation issues. So either very loose stools, which are diarrhea, can be diarrhea, or constipation, where people may not be able to have bowel movements. That's very important to understand that those are some of the basic questions. Now, I don't feel that those are particularly detailed, but those are usually the questions that are asked. And then oftentimes the physical exam will include pressing on the abdomen around the intestines. So usually the abdominal area is divided into 4 quadrants. And the organs are in those 4 quadrants. And then if there's pain, then that's kind of the way that we might assess the physical examination. And then we get into diagnostic testing. So blood test is often done. This is usually a complete blood count. So looking for infection, if the white blood cells are elevated, looking for anemia, if the hemoglobin is low, or if the red blood cell count is low. And then also looking for possibly some inflammation markers, which could include ESR or SED rate. And then there are some genetic tests that are done sometimes to look for celiac disease. You can also use the hemoglobin or red blood cells to evaluate if there is ulceration or esophagitis, inflammation of the esophagus. So those are some things. And then oftentimes the stool test is held off to see how people are doing after they usually go for imaging, which is oftentimes CAT scan. It's rarely MRI or ultrasound. Sometimes it's X-ray. CAT scan is often done with and without contrast, although I hear now that there's actually a way soon to take one of the markers from the red blood cells. So red blood cells usually have markers on them, little tags for different pieces of information that's transmitted through the body, and that might actually be a signal now to use as contrast instead of adding contrast. So I'm very much looking forward to that happening, and that might be something that you speak to your doctor about, if the CT scan can be done with the red blood cell marker instead of adding contrast orally, which has a lot of implications for the toxin that is in that. Barium studies often. And that's another thing that's often done is barium studies if people have a hard time swallowing or they have regurgitation. So that in that way, people are looking for structural abnormalities. But there is a lot that is not detected on imaging, or there's actually a lot that's not evaluated in the radiologist checklist for an imaging study. And it's very important to remember when a doctor does imaging studies to ask them if they have actually looked at the images. While radiologists have additional training, and that's exclusively what they do, doctors who are not radiologists have the capacity to look at the images to make what I call a second read, which is understanding the process of the organs that they're very well aware of and how they function and what they look like, to make sure that something was not overlooked by the radiologist. So if your doctor is relying exclusively on the report from the radiologist, to me, you need to seek another doctor, quite honestly, because imaging studies have so much potential if you actually know what you're looking for. And it's really important that your doctor is looking at the images themselves. All right. The other thing that most people will go to, the other thing that people find most commonly when they see a GI doctor is actually endoscopic procedures. So endoscopic, so gut, endo, or inside, scopic, scope. And these include colonoscopy and gastroscopy. And what they are is looking either up the tube or down the tube of the gut tube to visually inspect the GI tract and possibly take biopsies. So that's what you might see. Now, I have rarely seen someone come to my office who's worked with a GI doctor who's actually done a stool test. I think that stool tests are becoming more common for GI doctors to do, but I do find that it's pretty uncommon that even though this is a very informative test, it's often not done. And that's because a lot of the lab companies that are really large in our country are blood-based lab companies. So this is LabCorp and Quest. There might be other ones throughout the country, but primarily LabCorp, Quest. And then, of course, your hospital is mostly blood lab tests as well. So you won't find things like stool tests or salivary tests to give you more information. However, I'm happy to see that that's changing because stool tests are really important. Here is the product that is coming from your gut, so you can see things like visual inspection for infections, malabsorption, and inflammatory conditions. One of the stool tests that's being widely publicized right now is Cologuard. Now, Cologuard is used for cancer detection. It is more accurate than colonoscopy, and there is no risk for perforation of the bowel nor long-standing infection, which can actually occur from colonoscopy, and in very rare cases, even worse situations. Therefore, understanding that the stool test of Cologuard is actually a really important detection for colon cancer. And it really needs to be first line because it is so simple, it is so easy, it is slightly disgusting, I get that. But get over that for 10 minutes, and what you've done is saved yourself a world of potential problems, not to mention the the procedure in the preparation procedure for a colonoscopy, the colonoscopy itself, which has risks, and then the fatigue of the procedure, including the anesthesia. So all those elements occur with colonoscopy. So Cologuard is a fantastic diagnostic test. You don't actually need to go to your primary or a GI doctor. You just need to call the number. Okay, so that's again a very basic understanding of conventional medicine's approach if you're having a gut problem or a digestive issue. Now, so you get this in, you meet the doctor, the GI doctor. Hello, how are you doing? What symptoms are you having? Any family history of cancer or reflux or any family history of celiac disease? So you get these questions. Say, okay, lay down on the table, please. And they check the quadrants, and you probably have generalized discomfort, bloating. And they say, okay, let's get you scheduled for a colonoscopy and gastroscopy or endoscopy, and then let's also get a CT scan. Okay, so then that comes back. Let's also do blood work for CBC, and let's maybe get a SED rate, and let's see how your liver's doing with a CMP or comprehensive metabolic panel. Okay, you come back, your CT shows unremarkable. You had a colonoscopy, not much. Limited visual inspection, as always, because it's a tube that passes stools, so it's very hard to clean out and actually understand and be able to see what's happening on the walls, where it's actually where people are looking for lesions, right? Or inflammation, or pockets for diverticulosis. So let's get started with some medications. Okay, so if you have GERD, reflux, the first thing to do is stop the acid. So let's stop the acid by using antacids or antacids or H2 blockers, which are also hydrogen blockers, so acid blockers, or proton pump, which is an acid producer pump inhibitor. So for any acid-related condition. So basically GERD, possibly even bloating, Barrett's esophagitis. Let's stop the acid from being produced. Possibly start on some antibiotics, because maybe you have some SIBO. Let's look at some anti-inflammatory drugs for irritable bowel, and possibly some antidepressants as well. And then for using anti-inflammatory drugs for inflammatory bowel disease, and then let's look at some antispasmodics and laxatives for irritable bowel, including possibly benzodiazepines, which are actually an anti-anxiety medicine, but can be highly addictive. So when we look at antispasmodics such as that, I am reminded of a friend of mine who is a PhD physicist and was having some indigestion issues. He was told to take an antispasmodic, which included an anti-anxiety benzodiazepine, which is addictive, and to go ahead and get started on that so that he would not have as much gut irritation. Now, really, that was a course he was not interested in taking, and instead he looked at some dietary changes, reduced the amount of simple carbohydrates he had, and then he felt a lot better. And that was a very important lifestyle modification. Now, I do want to go back to antibiotics for infections. And while I do believe in instances of severe infection, antibiotics are very important. In cases where antibiotics are being used, maybe in general, they can have consequences for the gut that are long-term and depletion. So as you're aware, there are a lot of bacteria that live in the gut. When we sometimes put a general antibiotic in, then we end up kind of reducing the integrity or the number of the natural biotic or the natural microbiome or just the natural people, that the natural players rather, that live in the gut. So I always think of the gut as like a village, right? And so in a village, if you come into the village and basically eliminate everything, then you really haven't improved the situation, you've changed the situation. So some bloating might go down, some pain might go down, but now what we've done is we have a depleted village that has to be repopulated correctly, because it could be repopulated incorrectly. So that's just a word to the wise about antibiotics. Now, there are antimicrobials, and we'll get into those in a few minutes when we kind of compare and contrast, or how we take conventional medicine and incorporate it into holistic medicine, where I believe we are able to have more results faster with very few side effects. And again, looking at the goal of healthy at 100. So back to conventional medicine. Conventional medicine for gut medicine, the dietary changes are often FODMAP or gluten-free. So I appreciate the FODMAP. It's basically a way to rest the gut. The food is extremely bland. It's rarely any nutrition. It definitely is a kind of a no gut stimulation attempt. So gut rest is really what FODMAP is offering. I sometimes think of it as like zombie eating, because you're eating things that are so unstimulating to the gut. You're not going to produce you're not going to feed the gut. You're not going to produce a natural response of healing. And healing is very stimulating, and healing makes waste. So if you put something in that's very bland or zombie, then you end up not having garlic and onions and legumes. And so you end up eating like a very bland diet. Now, that might, again, the goal might be to offer gut rest, but it's really important to recognize that you really can't live on that diet, and you shouldn't, because it's oftentimes very void of nutritional quality, and it's really bland. So we want a nice, healthy, robust gut, right? So, okay, FODMAP for a little bit, but I'll talk about some of the other dietary approaches that I have in my practice. The other thing is gluten-free diet. Now, gluten definitely plays a role in our kind of standard American diet. So gluten is an additive for a lot of foods. There are some oatmeal companies that increase the amount of gluten in the oatmeal to like 400 times the natural amount of gluten. So gluten is a natural part of grains. But what happens is it's either fortified, or people eat a robust amount. They eat a ton of gluten, and then their gut will bloat, and it will feel full, and then it will be an irritant to the gut lining. And as a consequence, it will also be an irritant to the thyroid, because gluten has a similar structure in biomimicry. So gluten and thyroid tissue have a biomimicry, and so the immune surveillance will sometimes tag gluten as structure in the gut, and then it will recognize a similar enough structure in the thyroid and start to attack the thyroid. So that is a component of celiac. That is a component of inflammatory bowel disease. And then it starts to look at a systemic issue from the gut to the thyroid. All right. When we look at gluten, though, gluten-free simple carbs are still irritating to the gut. So gluten-free muffins, gluten-free cakes, gluten-free cupcakes, gluten-free donuts. These may be gluten-free, but they are basically 100% sugar, because many of the flours that are used that do not have gluten are rice. There's a one that's used all the time that I can't remember the name of. But anyway, tapioca, that's another one. So gluten isn't in this particular grain, but this grain is ground up so fine as a flour that you end up just feeding the body a lot of simple carbohydrates. So please be very cautious when you're looking at gluten-free 100% carbs, okay? Because that is not solving the problem. And I definitely got involved with that when gluten-free became very important, 10 or 15 years ago. And we started recognizing that gluten excess was causing problems, but didn't realize that gluten-free muffins were actually also problematic. So gluten-free, very simple sugars are not your friend. You have to look at things that are gluten-free, that are plant-based, that are non-grain plant-based. So you look at, your fruits and vegetables, look at almond flour, almond meal, look at different grains and also try to keep them more in their whole form. So that is just a little different understanding or approach, but gluten-free diet to support gut health, even conventionally, does not mean going for gluten-free simple carbs. Okay, but there's sometimes not that clarification, and people might feel better because they're off of gluten, but they really aren't serving the long game. Okay, fiber intake. Fiber intake is really essential. Now, oftentimes people will get the recommendation of Metamucil. Now, there are a lot of fiber product options, and I would say things that are loaded with artificial colors and synthetics are not your best option. Metamucil has within it psyllium husk. So basically, psyllium husk is a fiber. You can buy psyllium husk actually a lot cheaper. I don't particularly like that option either, but fiber intake is often seen as Metamucil. So another modification might be regular physical activity. A lot of times that's a very vague lifestyle modification given in conventional medicine, because really what you're hearing is you need to lose weight. So that is sometimes a sugar-coated way of telling people that they need to lose weight. Other times people are told frankly that they need to lose weight, and other times, hey, just increase your salad intake and you will feel better because you'll lose weight. Well, that is not exactly fair nor true. Now, obviously, definitely ideal body weight management is very important, but it isn't that you just need to go and lose weight, because if that's all you needed to do, then that's what you would have done, right? And sometimes physical activity can be so aggressive that it actually stresses the body and the gut, and it does not do you any good. Also, if we talk about when people say eat salads, salads are very difficult on the body. And so because they're raw, they take a lot of time to break down, and you don't get a lot of nutrition from something that takes you a lot of time to eat. So, thinking about that is with a little bit different perspective, and I'll explain that a little bit later. And then the fact that, yes, you do want to increase your basal metabolism, but that is very difficult when your stomach hurts a lot. So, and then of course, in conventional medicine, there are some recommendations sometimes for surgical interventions, which might mean removing part of the bowel, particularly in cases of inflammatory bowel disease, celiac, if there are bowel obstructions or strictures, and then in cancer. Cancer is a whole different topic, really, for gut health and gut medicine, but I did want to include it because it's very important. Colon cancer is one of the most common cancers, and I will be talking about that in a future podcast for sure. In the meantime, I want to shift gears into kind of holistic medicine evaluation and treatment. So, a lot of times when I talk about holistic medicine, people think that what I'm talking about is some simple, more health coach level lifestyle modifications. And I do think those are really important, because lifestyle is your everyday way of helping yourself be as healthy and strong as possible. And it is really foundational for you to live a healthy life. A lot of times health coaches are wonderful people to give you that baseline kind of helpful accountability, simple messaging, really help you, recognize some pitfalls that might be contributing to this. For example, you drink 4 double espressos a day and you wonder why your stomach hurts. You're not getting much blood supply because the caffeine is a blood vessel constrictor. Your gut has a lot of blood vessels, and it's the blood that supports the muscles to contract and move the waste out of the body. So again, if you work with a health coach, they might ask you how much caffeine intake you have. And also, they might ask you when you drink caffeine, because you might not be recognizing that green tea that's so healthy for you, but you're having it at 9 o'clock at night because you've been told to drink tea before bed to help you sleep better, but you have a caffeinated tea. And now with the caffeinated tea, it's keeping you up. Or you drink a decaf coffee or a decaf tea, but it still has a little bit of caffeine, and that serves as a stimulant for you. And then you're not able to sleep. And so a health coach can definitely recognize some of those things. Another pitfall is people who drink a lot of milk and then they have inflammation, right? Particularly cow's milk can be very inflammatory, particularly if highly processed. And so that's something you want to deal with a health coach on, because a health coach is going to help you with those things. Very cost effective, and you can get results that are long term. So a health coach is going to help you in a lot of those areas. And I think that's really important to understand that is very much about holistic medicine. Integrative medicine, functional medicine is that level of the therapeutic order where patients work with health coaches who are also working with physicians. So they're a lot more in the pulse of actually how to help people effectively and very results driven. But they're looking at the things that can be done by you with a little bit of support. And then I also sometimes think when people think about holistic medicine, it's kind of like a dim version of conventional medicine. Like we just kind of talk about things because, are we really introducing science? Yes. Are we really introducing evidence? Yes. Are we really looking at root cause treatments? Yes. And are we really looking at the long game? Yes. Because when I look at my patients, I think about healthy at 100. And that's what you should think about too, in my opinion, with all due love and respect, that you need to be looking at what your treatment plan is going to do to keep you healthy at 100. Okay? So everything you think about, in my opinion, regarding your health, it's very important to go with the outcome of being healthy at 100. Okay. So what are the things that help you in general? As I mentioned, with the holistic health coach, you're looking at some dietary interventions. You might be recognizing some food sensitivities, doing some basic food elimination protocols, maybe doing the Whole30 and looking at how to remove processed foods from your diet, which are much less natural, and looking more at prepared and whole foods. Then looking at balanced nutrition, making sure that your body is getting good healthy fats, avocados, walnuts, lots of nuts and seeds, chia seeds, that really can help you with fiber, with protein. It's plant-based. It doesn't have to necessarily be plant exclusive or vegan, but definitely plant-based, where you're looking at 9 to 12 fruits and vegetables a day. And that is a lot to take in, particularly if your gut hurts. If that's the case, you might look at blending. Your blender can be your best friend when you're thinking about making food a little more broken down and easier to digest, because it's already been broken down a little bit by the mechanics of the machine. All right. And then nutritional supplementation is interesting because a lot of times people think, well, I'm just going to take this probiotic and I'm going to be fine. And for some people that works, and that's great. But I think sometimes when you look at probiotics, you're adding a lot of village people to the gut, and that might not help you if you have a lot of gut imbalances. Again, I kind of call village people, like I look at the village, I think about probiotics as, adding to the village, because it's like you're not really supporting your microbiome necessarily if you're overwhelming it. Now, again, probiotics are very helpful. I think it's paramount to look at putting a nutritional supplement with probiotics that also have a yeast balancer like Aspergillosis. And that's why our optimal probiotic has the Aspergillosis, because a lot of overgrowth in the bowel is actually candida or fungal overgrowth or yeast. And so if you're adding more village people, but you're not balancing the yeast or the candida, then you really aren't necessarily addressing a problem. And it's nice when you get both of those together. Prebiotics definitely support the gut. They feed probiotics, but you can get a lot of prebiotics in food, and you get a lot of prebiotics in the non-FODMAP diet. So the FODMAP diet is removing a lot of prebiotics. Like I said, garlic, onion, a lot of herbs are gone. So prebiotics are those things that feed the natural biome, and they also usually have a lot of great antimicrobial properties. If you cannot tolerate garlic, onion, that's really important that you have an infection going on, most likely. From an educational perspective, of course. But you have to recognize that if your gut is really intolerant of garlic and onion, these are things that not only feed the natural biome, but they also fight for balance. So that is very important. What you might start doing is actually putting garlic with some oil, or putting onions in some oil, and then moving the actual plant material or bulk away and just using the oil. That way you're getting some support in. And then 2, experimenting with different herbs so that you can see how to support your gut biome without being reactive or over stimulated. But in general, I do not believe that probiotics are the first line therapy. I do believe sometimes, though, it helps. But again, if you're not getting anything from this, or you have a severe gut condition, you can expect very little results from probiotics. As I mentioned, herbal remedies. So, of course, peppermint oil can be supportive in a lot of ways. Turmeric. A lot of people think about taking these things orally. I might suggest topically on the abdomen. I happen to love neem oil. Neem oil topically is actually better than neem oil orally. So neem oil topically is actually better than neem oil orally. And that's a fantastic supplementation that's very affordable and fairly easy to find. So NEEM, it's been used as ancient medicine for a long time. Then another important supplement is omega-3 fatty acids. They're very good at anti-inflammatory. They're very good at improving your fat intake. And they're often absent. They're often very depleted when my patients come and talk to me about getting treatment. So when I do their labs, I see that the omega-3s are often absent. Okay. And then, of course, looking at hygiene for your sleep. So as I mentioned, like having even decaf green tea or decaf coffee before bed might actually be a stimulant, and then not allow you to sleep as deeply as possible so that your gut can have restorative time. Another issue often is hydration, and not just tap water. You really want to look towards alkaline water. You want to look towards water with some minerals, possibly a little bit of electrolytes in there without going very high in sodium. All right, and obviously regular movement to support gut motility. And I say regular movement because a lot of times people actually need to stretch open their abdomen so that they can improve the length of their muscles in their core and get that space so they can actually have the motility that they need in their gut. And then, of course, a really important consideration in gut medicine is the connection between the gut physically and also the mind. So that mental, physical, and then emotional factors that play into digestive health. So we want to look at stress techniques, of course. I like to make sure that people are aware that they really need to take a moment when they eat and make sure they're looking at the food, they're touching the food, they have the senses, so then they get into the digestion process and their brain is focusing on digestion, which activates the parasympathetics, or the calming part of the nervous system, because it's the calming part of the nervous system that then allows for digestion. The other thing to look into is the gut-brain axis. A lot of neurotransmitters or neurologic information markers or biomarkers actually originate in the gut. And so things like serotonin, dopamine, even B12, cobalamin, these are all things that actually support brain health. So there's a very important physiologic connection there that's bidirectional between the gut and the brain. As I mentioned with stress, that will not only decrease blood supply to the gut, it will also increase inflammation and stagnation of the muscles in the gut. That is important. And then looking again about just enjoying what you're eating, enjoying the company that you have, preferably staying away from TV so that you can enjoy what you're eating and be involved in that senses of taste and smell instead of visual. Because when you are watching TV, you will go towards visual sensory, and that is a predominant sensory in our brain. And so it might diminish the smell and the taste of the food. So this is just a 15-minute break in your day to enjoy what you're eating away from TV, movies, etc. That will allow you a better connection mentally and therefore physically with your food. And then I want to get into a few minutes of really what is this holistic medicine with common conditions like IBS and IBD and GERD and celiac and peptic ulcers. When we look at this, obviously we look at lifestyle. It's much more elaborate in terms of questioning. And then stress levels, emotional well-being. Oftentimes you'll be asked to do a log of what you eat. We'll understand your sleep patterns and physical activity. A lot of that would be done with a health coach or prior to an intake with a holistic medicine doctor. So the other thing is definitely looking at food sensitivities and comprehensive stool analysis. So what I also like to do right in the beginning for gut health is I like to see what is the metabolic health. I think the metabolic health is where the rubber hits the road. If you're deficient in D, your gut's not going to work very well. If you're deficient in B12, then we know your gut's likely having struggled with absorption. If you have thyroid antibodies, we know that the gut has some inflammation and likely has leaky gut. When we look at lipid deficiencies, we know that the lining of the gut is being impacted as well. And then we look at the next step, which is the stool analysis. What are frank pathogens that are living in the stool? I have met with people who have worked with functional medicine doctors and conventional doctors and everyone, and no one has done a stool test, unbelievable but true, and they haven't looked for serious infections like cholera, giardia, E. coli, that's gut hemorrhagic or enterohemorrhagic E. coli, Shigella-like E. coli, C. diff. All of these can be treated. And all of these are not necessarily acute problems, meaning just happen, you get over it. Actually, these pathogens can stay in your body. And it's not just bacteria, it's also parasites, and it can be viruses. So like adenovirus, norovirus. The other thing is, are there parasites? Okay, are there helminths? Then what is the gut biome normal village people look like? So what's the normal gut microbiome players, including Akkermansia, which is a very important thing to replete, but I usually get it repleted in 1 to 2 bottles. It's not something someone needs to stay on for any length of time. Because then if they have the prebiotics and they're working on emotional well-being and digesting their food so that they can absorb their food and keeping their calm nervous system of the parasympathetics on, then they start maintaining the natural biome and the supplementation that they put in stays. So therefore, I usually only have Akkermansia for 1 month, sometimes 2 months. And it is a great benefit to our society that we have Akkermansia available to us for therapeutics with the microbiome. The other thing looking into comprehensive stool analysis is what are the overgrowth or dysbiosis? Okay, what is intestinal health? So how are people digesting their fats, their proteins, and then what kind of inflammatory markers are present, whether it's zonulin for leaky gut or calprotectin for inflammation, and also a marker for colon cancer. There are a lot of things to look at. Additionally, beta-glucuronidase. How is your immune system responding in your gut? That also includes secretory IgA and looking at anti-gliadin. So you can actually see gluten's impact on the gut. All of these things can be addressed and reversible. And most of the time, I barely use an antibiotic. I usually only use an antibiotic for Giardia because it's 93 to 100% effective in one use. And I feel like that's a big win because Giardia is a very significant pathogen. Everything else is herbal or nutraceutical. And so you can get a lot done with the gut in a very short amount of time. That's the other thing to look at, is the gut turnover for the cells is 23 days. So a gut protocol really needs to be working for you in 90 days. And if it's not, then it's not working. Okay, then there's either something more going on in the gut, or that's been missed, or there's something deeper systemically happening. And that is really important to recognize. The gut has very good turnover. A lot of times simple things that are based in lifestyle are very effective because the gut plays into the brain. It plays into the emotions. It plays into how we process relationships and stress. It plays into sleep. And so all those things can obviously be impacted in the positive. All right. The other things that I would say is understanding that function follows form, or structure plays an important part in function. And so looking at some ways to adjust the gut can actually be really helpful with physical medicine. And the other thing is actually just elevating the gut to wearing a belly band or a support there. That's a very important, simple thing to do to help everything get going. So again, holistic medicine kind of looks at, I say, the forest and the leaves. What is it that's going on every day that is impacting the gut and that we can do to address it as medicine, as a therapeutic? And then what are these bigger issues, kind of this big forest approach to understanding if there's something larger or more systemic that's playing in and impacting the gut. And that can include neurotransmitter deficiency. It can include infection. It can include deeper underlying issues in the gut. Thank you very much. It was very much my pleasure to present this to you. And I look forward to the next episode in our series. Have a beautiful day.